Hi everyone, happy 2019. It's been a while since we did our last streaming, and today we're going to share a couple cases. It's about hearing, and there are three cases I would like to share. Number one is female, 28 years old. She had some ear infection, and then that leads to hearing loss on the right side of her ear for a few days. And the second case was again female, 37 years old. She had she had a bit of common cold, and that led to hearing loss on her right side as well. And the third one is female, 64 years old. She had a dizzy spell and tinnitus, meaning there's ringing in her right ear, so constantly high-pitched noise ringing in the right ear. It's called tinnitus. And also she had a bit of a bloated abdomen and some urination issues as well. So first case, she is a flight attendant. So as a flight attendant, you are constantly adjusting your time schedule. You basically have jet lag all the time. So because of that, her body is very, very tired, and she gets sick quite often, and whenever she's sick, it's quite serious. So she had a cold, and then that led to ear infection, and then completely lost her hearing on the right side of her ear. And because it happened in such a short time, she only lost hearing about a day or so, maybe 2 days, before she came to see me. So so after that quick diagnosis, I gave her acupuncture treatment, and she rested in one of my rooms for about 2-3 hours. And after she woke up from her rest, the hearing came back completely. So usually when there's acute syndromes happen, such as sudden hearing loss, it's not something that's caused from your internal balance. It's basically there's outside factors that kind of affect how your body functions. So the ear is like a microphone, if you look at it that way. A microphone needs a battery, or it needs connection to its power source to function properly. So if all of a sudden there's a blockage from the power source to the battery, to the microphone, and the microphone wouldn't work all of a sudden. So in Chinese medicine, the meridians goes around our ears. One is called Sanjiao meridian, and the other one is called the gallbladder meridian. They both belong to one of our term called Shaoyang. So let me spell that for you. It's called Shaoyang. So meaning, you don't have to look, I don't want to go too deep into that name. So basically these two meridians can be grouped together into this Shaoyang group, and whenever something suddenly happened to your ears, to the hearing, this is the first source of trouble, first line of, how should I say this, first thing that we look at to check if there's any trouble with this meridians. So basically she caught a cold, and it suddenly affected the meridian in the Shaoyang meridian, and it blocks off the power supply to your ear, and the ear stop functioning properly. So in Chinese medicine, we call this qi and blood blockage. So once we clear this blockage, the power is able to go back to the ear, the qi and blood is able to go back to the ear, and the hearing can be restored very quickly. So with her treatments, I did a couple of acupuncture points on her ear. So basically, one that's treating the inside of her ear, the other one, another one is outside of her ear. Another one is for the gallbladder. The other one is for the sanjiao. So basically, 4 points on her ear to address the physical part of the ear and also the meridian part of the ear. Plus needling on her arms, hands, and feet. So on the hand, there's also this sanjiao meridian basically goes from our ring finger all the way up to our eyes are passing through our ear. So if you have watched our acupuncture videos before, you know that the points on our hand can treat disease on our head. So basically, the points I needle was here, and it kind of corresponds to the location of our ear. So same thing with the point on her feet. So the point on her feet is affecting part of the gallbladder meridian. So basically, using the same meridian, treating basically from the head of the meridian, treating the tail of the meridian. So using one end to treat the other end, and so it was very effective. After 2 hours of sleep and treatments, she woke up feeling energetic and feeling rested, and her hearing was restored very quickly. So it's anything acute happens to your body, Chinese medicine or acupuncture can address it and kind of restore the function very effectively. And the second case is also a female, 37 years old, I mentioned. So basically, before she came to see me, she had a common cold. So she was feeling cold, chills, maybe a little bit of fever, a lot of running nose, sneezing, nasal back drip to the throat. And after all these cold symptoms were gone, she started noticing that her right side of her hearing is kind of blocked off. Feel like she lost maybe more than half of her hearing on the right side. So because she had to go on a plane in a very short time, so she was worried that this ear infection might affect her on the plane, might give her a lot of pain in her ear when she's on the plane with pressure change. Before she came to see me, she also went to see her family doctor, and her family doctor gave her antibiotics for her ear infection, and she took about 3-4 days. Didn't see any improvement at all, so she was a bit worried. That's why she came to see me. So this patient was, I told her that we just recently had a case that using acupuncture to restore hearing very quickly, and she was an old patient I've seen before, but I know she's afraid of kneeling, but because I told her about how quickly the therapy effect is, and she agreed to it. But after we did inserted a couple needles, and then she was more sensitive to pain, so she didn't really like it. So instead of using acupuncture, I gave her the herbal medicine formula instead. So remember we mentioned Xiaoyang is a big factor in when there's a sudden hearing loss. So the typical formula that treats Xiaoyang problem is something called 小柴胡汤. I have mentioned this formula quite a few times in our previous episode. So 小柴胡汤. So 小柴胡汤, anyways, is a formula that can quickly resolve any 消阳 issues, anything affecting the meridian of the gallbladder and sanjiao, or anything that's actually affecting the organ of gallbladder or even liver, because they're closely connected. I also added 2 other herbs. One is called Fuling. I mentioned that before as well. It's a herb to regulate your water passage. So basically, to regulate your urination. Because this patient, she's quite young, but she gets up every night to go to washroom once or twice. It's not normal. So besides addressing her acute hearing loss problem, I also want to address some of her fundamental issues to help her recover quickly. And the second herb, is added is called jiegeng. So that I haven't mentioned before. Jiegeng. Jiegeng right here. Basically, it's a formula to use when there is a pus being built up in your system. It has a very strong effect of clearing pus. Because I added this herb because the patient says she can still feel some discharge coming out from her ear, and it's kind of like watery but also kind of sticky. And she told me that she can hear her heart beating in her right ear, so that means that there's a lot of fluid accumulated in her ear, and that the fluid is amplifying the pulsing of artery. So that's why she was able to hear her heart beating in the right side of her ear. So after a week of taking this herb, her hearing came back about 20 to 30%. Which is a good thing, and she said that the fluid discharge from her ear is completely gone, but her urination hasn't improved at all. So that gets me thinking that maybe we need to adjust the formula to address more, to go higher upstream to find out the cause. So sometimes when there's a urination trouble, we're only treating the bladder and the kidneys, might not be enough. So sometimes we have to go upstream to look at the heart, because the heart plays a strong factor with our water metabolism and urination as well. So after diagnosis, I make sure that I added guizhi in her formula, and also baizhu into her formula. So it's instead of 小柴胡汤 plus 2 single herbs, I used 小柴胡汤 plus 灵桂竹甘汤. So it's Fuling, that's already in there in the first prescription. Guizhi, what I just mentioned, it's the cinnamon twigs that strengthen the heart. And baizhu, I forgot the common name for that. Basically, it's a herb to also improve water metabolism, but it's mainly to reduce swelling in your body. So this patient has kind of puffy face, puffy eyelids, especially in the morning. So this is a good combination that I thought at that time to help her improve her fundamental functions, and as well as addressing her acute hearing loss. So I gave her a week worth of formula, and about 5 to 6 days later, she texted me, told me to cancel her next appointment because her hearing came back 100%, and she's happy with that. She just before she's about to go on a plane and take a trip. So, and the next case is a older female, 64 years old. Suddenly she had a dizzy spell with like a lot of ringing noise in her ear. And at the same time, she also had a lot of abdominal bloated abdomen, so a lot of bloating in the abdomen. She wasn't able to urinate as normally, so she has a lot of water retention in her body, and she doesn't go pee as often as she did regularly. So in Chinese medicine, when we see dizziness, first thing that comes to mind is water retention, because right now our body is about 70% of water, and when there's too much water, too much or too little water, it can affect our body functions. And from Western medicine, we know that the ears are in charge of keeping our body in balance, and there are a lot of fluid in our ear to kind of balance ourselves. But when there's too much fluid, it's like you have a scale that's sitting on a rocking boat, so your ear is not able to function to keep your balance because there's too much fluid flowing around. And again, and at the same time, that affected her hearing and kind of blocks off the qi and blood going to her ear. So her treatment part of it was the same as what I did for the first case. So needling the Sanjiao meridian and the gallbladder meridian on the foot, and also a couple points on her ear to address the acute issue. Funny thing is, when I'm needling the ear, I would check for tender points. Her ear points, like inner ear and outer ear points, were not tender at all. Instead, it was more of her cervical spines and basically her nape in this region. So I did that instead, and also on her body, I also added points to address her digestion, because she was feeling very bloated. She was burping a lot. She felt really full. She couldn't eat very much. She ate a little bit, and she would feel full right away. So I added a point called PC6, which is a company PC6 and spleen 4, PC6 plus spleen 4. These are the 2 points, and this combo usually is very effective for addressing any discomfort in the abdomen. It can be diarrhea, it can be stomach pain, it can be vomiting or nausea. So anything that happens in this region, these 2 points can address it. I also added another point, spleen 9. Spleen number 9 is a point that's just below our knee, which is a very good point, very big point for improving our water metabolism. And so basically these 3 points plus 3 other points to address the ear issue, the Shaoyang meridians. And after about 45 minutes of treatment, her hearing, the noise in her ear decreased quite a bit, and then I also prescribe herbal medicine for her to take. And then after she kind of cleared out all the retained water from urination, her dizziness got better. So so basically that's the cause of her dizziness, and so the abdomen is not able to kind of like process the water and then the water gets overflow and not able to get rid of. Her body wasn't able to get rid of it, and that's causing the dizziness and the ringing in her ear. So all three cases are hearing related, and they have some common grounds, like common part. They're also like there's different cause as well. So anything that happened very quickly, the recovery. If you go see an acupuncturist or your TCM doctor, they can address it very very quickly, and then you don't. And you'll recover very quickly, so you don't need to take a long time. If you waited for a long time, then it's gonna, it's gonna take more time for you to recover. I think that's it for today. If you have any comment, please leave your comment below and press the like, or you can share it to your friends if they have any hearing issues. This might be an option for them to get better or to improve their hearing. So if we know what's causing the hearing issue, we can address it with acupuncture or herbal medicine. So basically, if you know the problem, you have many ways to get to the source of the problem, right? So it's not limited to one treatment for a certain disease. Yeah, that's it for today, and I'll see you next time. Thank you. Bye.